and here's the aorta. So it's a fairly substantial artery going down as far as here. There are 4 sections of it. The first section is the so-called ascending aorta because it's going upwards for just a little bit of its length. The only thing that actually comes off there, the only 2 things, are the left and right coronary arteries, which aren't even shown here. So italics and brackets means that you can't actually see them, but they're important enough to mention. So they're literally the first branches off. Sometimes there's a little question in one of the quizzes, what's the first branch off the aorta? So the coronary arteries are the first branch. And then we have the ascending aorta here. Pretty hard to actually put a little tag on the ascending aorta and really make it look like you didn't mean this part here, which is the aortic arch. So probably wouldn't bother with it, especially if we can't see the coronary arteries come up. But there it is. Then this part here is the aortic arch with 3 vessels off it. So I could put it there. Then you'd put aortic arch for number, whatever that is, 7. And then the descending aorta is generally divided into 2, the thoracic aorta above the diaphragm and the abdominal aorta below. And you might think, that's a lot of parts of the aorta. But I was telling everybody earlier about the importance of putting the vessels and well, I'll talk about that later. But anyway, let me just talk about that later. We'll get on with this. So there's the aortic arch. Off the aortic arch, we have 3 big branches coming up here. We've got to supply 2 vessels up to the head and 2 vessels around to the arms, and so that totals 4, but we've only got 3. So on the right-hand side, the neck and head vessel and the arm vessel are going to come off together and then split off. On the left-hand side, the 2 vessels are going to come off separate. So the one going up to the head is the carotid artery. So it'll be the common carotid artery. This would be the right common carotid artery, and this would be the left common carotid artery. And they're going up the neck into the head, so that's where you get your carotid pulse. And then they're going to split into the internal and external carotid artery. The internal is the one that goes to the brain and goes through that carotid canal, if you remember from 231. The external supplies all the rest of the face. So face and head and so forth. So on the left-hand side here, they're showing the left common carotid artery. Then this part here is, because it's given a slightly different number of 18A, supposed to be the external carotid artery on the left-hand side there. On the right...
Which one's the internal?
The internal isn't even shown here. It would go through the skull.
All right.
So this would be the external, left external carotid artery. So you need to mark them. When you mark them on the sheet for the practical, you need to put just L or R is fine, and A or V is fine. But you need to say if it's artery or vein, and you need to say if it's left or right. So that would be left external carotid artery. And this would be left common carotid artery. Common because the blood supply is common to the 2 that it's going to supply. So even though there's tons of other good stuff going on there, we're going to temporarily say that's it for now, because there's not a lot shown in the model. And we're going to look at the vessels which are going to go round to the arms, the subclavian artery. Subclavian because it goes underneath the clavicle. So the subclavian artery on the left is here, and on the right is here. It also has 3 little branches coming off of it, kind of like this. And it's curved kind of like this, so don't mix up the aortic arch, which is coming right out of the heart and is huge, compared to the subclavian artery going around here. So there it is. If I was going to put it, I'd put it kind of conveniently in the middle of its run. It's going to change its name here. This is the axillary region where the armpit is, so this is the axillary artery. On the left axillary artery. Then the brachial artery over here, pretty much where the diaphysis of the humerus is. So over here, we have right subclavian artery, right axillary artery, right brachial artery coming down to here. The brachial artery is going to divide into radial and ulna, and so this person's standing there, palm forward, anatomical position, so then we can assume this is the thumb here. So this is the radial artery. You know, the radial pulse is on the thumb. This is the ulnar artery, and that's about as far as it's going to go in terms of the ones we've got to look at. Over on this side, the person's twisted his hand around like this. So if I'm going to mark the radial ulnar artery, I'll mark him over on this side here, because then it's a little easier to see between there for radial or ulnar there. So leave the ulnar artery as number 5 for the moment. So down here, I feel like I can go down about as far as the brachial. But there's no need to be ridiculous confusing. One other one we're going to have to know, and it mentions it here, the vertebral artery. That's going to come, we'll use this one again. The very first branch off the subclavian artery is the vertebral artery. We don't have to worry about the others, but this one, what it's going to do, it doesn't look like it goes anywhere much. What it's going to do is it's going to go back and going to go up along the vertebrae. And if you remember from 231, these transverse foramens that are only, I guess I'll put that the right way up, transverse foramens that are only in the cervical vertebrae, those are housing the vertebral artery, which is going to go up and then join to the basilar artery and join to the circle of Willis and so forth. So those are the vertebral arteries, and they kind of maybe supply the vertebral region a little bit, but mostly they're supplying the brain and or the back of the brain anyway. So those are fairly important ones, and so even though they're small, they're mentioned as possibilities. So I think I've got those down. We've got these branches here coming up. Make sure you know the 4 main ones, and then follow the passage down the arm, and don't forget the vertebral. So now we're going to go down to the abdominal region. Ready to go? Mm-hmm. All right, so then the thoracic aorta we really can't see. So because it's behind the heart and on the model it isn't there. It would supply all of the intercostal muscles between the ribs and so forth, but it's not there, so completely hidden. This is the abdominal aorta then, and it has various branches, and the main ones that we're going to look at in here are all supplying abdominal organs. So the first one off here is the celiac trunk. It's a little hard to show, but what it's going to do, it's starting here, it's coming out of the aorta, it's short and stubby. It looks rather thin on here, it's a fairly significant artery. But, well, it is, but it looks like it's going to split into 3, but these 3 don't look any bigger than, don't look any smaller than, it seems hard to imagine how it could. So it should be thicker, but there it is, short and stubby. So the word trunk means an artery that's going to split immediately into a couple of others without really having tributaries of its own. It's just going to be a thoroughfare. So here's the celiac trunk. This part, which I know I didn't mention because it's so hard to show, you can't really see it, but the little place, I'm going back now because I realized I never actually said it. The brachiocephalic artery is, or brachiocephalic trunk, is this little part where the blood is common to the common carotid and the subclavian, if you see what I mean. Because it's impossible to see, there's really no way that I could realistically say what's this and have it not seem like I'm asking the aortic arch. So probably would not ask you that, but that's what that is anyway. So there it says brachiocephalic artery, the first one off of the aortic arch, and then the other 2. So getting back to here, so celiac trunk means it's going to immediately branch into others, in this case 3. So we've got the splenic artery going, this is meant to be the spleen. Hepatic artery, this is meant to be the liver, so actually the common hepatic artery. And then the left gastric artery, which is one of the main arteries supplying the stomach, which isn't shown, so it looks like it doesn't really go anywhere, but it is going to the stomach. So that question sometimes comes up as well in those quizzes or whatever, is which of the 3 vessels supplied by the celiac trunk. So you'd want to know what the 3 are, and there they are listed. Then we have, well, I'll show the renal arteries because those are nice and clear. There's a left and a right because we have 2 kidneys, and the renal arteries supply the kidneys. So renal meaning kidneys, so we have a left and a right renal artery. These 2 are the superior mesenteric artery and the inferior mesenteric artery, since this one's slightly higher in the body than this one. Superior mesenteric artery and inferior mesenteric artery. They don't look like they're going anywhere, they're actually supplying the intestines. Why they're called mesenteric, what a mesentery is, here's, for example, the large intestine. it's got this webbing of connective tissue here, which partly anchors it, but also allows the vessels to supply their blood, and then the arteries, and then the veins to drain back out. So rather than starting here and running out of oxygen by the time you got to here, they can just distribute and return. So the inferior mesenteric artery is basically supplying the large intestine, and the superior mesenteric primarily the small intestine, plus a little bit of the large intestine that's up here. So both intestines have a mesentery like that, and that's why it's called mesentery.
That little knob on there, that's the superior?
That's the superior mesenteric artery. I know it would be, the problem is all the digestive viscera have been taken out, so all these things don't have anywhere to go. But so this, for example, is the inferior mesenteric artery. So this, that doesn't look like it's doing anything, is really going to supply most of the colon.
And what does that supply again? The superior and inferior, I got those confused.
So the inferior mesenteric artery is supplying the large intestine. Most thereof. So let's just say the large intestine. The superior mesenteric is supplying the small intestine.
And you might mark those, right?
I could easily, yes. It's kind of hard to do, but I think if I put it right there, hopefully it's obvious enough I'm going for the superior mesenteric artery and not the aorta, because it's, there's nowhere else I can really put it. So, and then the
renal is in between them, right?
Right, the renal are going straight to the kidney. So those are hopefully clear enough. So that'd be a nice, easy one. You just have to remember to put left renal artery if I put it there. So otherwise it's only half the point.
Don't forget those.
Don't forget L and R, don't forget A and V. Not everything has a left and a right. And I mean, for example, superior mesenteric artery doesn't have a left and a right because there's only one of them. Not everything has an artery and a vein, like abdominal aorta does not have. I want to make a better shot of it. There. Doesn't have aorta artery, but most things have a left and a right, and most things have an artery. So the aorta's now come to an end, and we're going to go dividing off. So this is the iliac region here. The ilium is one of the bones of the pelvis, the iliac crest. So this is the iliac region, at least it's being called that for the purposes of this. And once again, I've got a common iliac artery, which is going to divide into an interior and an exterior iliac artery. Kind of like the common carotid divided into internal and external carotid. So the internal iliac artery is supplying the pelvic region. The external iliac artery is going on down to the legs. And right about here, it's going to divide. There's going to be some branches of which we need to know these two here. This is the femoral artery, or femoral. Again, corresponding to the brachial. It's pretty much along the diaphysis of the femur here. And this is the deep femoral artery. So it's just a little bit deeper than this one. So there they are, the femoral and the deep femoral artery. Those we're not worrying about, we're worrying about only the ones that are on there. So, and again, we've got a few name changes. So we had, I guess, the common iliac artery, then we had the left external iliac artery, then we had the left femoral artery. This is the popliteal region behind the knee, so left popliteal artery, and then it's dividing into the anterior and posterior tibial arteries. So luckily the anterior tibial artery goes in front of the tibia and the posterior behind it, so there's some method to their madness. And then we almost don't feel we need this one because we didn't have any hand, but they put the dorsal pedis artery, and perhaps the reason why it's on there is next week when we're testing for the pulse points, that's one of the ones. It's actually kind of hard to feel, but down on the foot you try to feel where the dorsal pedis artery is. Kind of faint, but you can get it. So right down there. So those are the arteries, except for one important one, which is the pulmonary. Once again, pulmonary trunk suggests, like celiac trunk, that it's going to split without really doing much else other than just splitting. So here's an artery coming off and dividing into the left and right pulmonary arteries. Notice its color. It's blue. So what if I put one of these on here? You'd have to say it was the left pulmonary artery. So you know that I'm probably going to trick you with one of those. Like if you know those Men's Warehouse commercials where the guy comes on and says, I guarantee it. You know those ones,
Yeah,
right?
is that what you're saying?
I pretty
No,
much
that
guarantee it. Yeah, make sure because there's always someone who gets it wrong and puts vein. It's like no, don't just go by the color, and you've got to remember the pulmonary system is the other way around. So, okay, the lower limbs of the veins. We'll work our way back up now. Oh, so this would be the right pulmonary artery. It looks like it's going into there, but actually it isn't. It's this.
Okay.
They're using whatever. Yeah, so if it's in the lungs somewhere here, then it's a pulmonary artery. If it's blue, it's a pulmonary artery. Okay, so then lower limbs, they don't really show a whole lot of veins. There's none over here at all. And over here, a lot of them are either just little bumps, like I think that's meant to be where the femoral vein is coming in. One of these is meant to be the deep femoral vein, perhaps that one. But they're not really showing them connected, and it seems a little unfair. So there's only one really good one, which is showing. Might require a little explanation, the fact that pretty much all these arteries have a vein that has their same name that is their partner vein. But in the limbs, it's difficult to get the blood back in a vein. It's pretty easy to shoot it down with the blood pressure in the artery. Getting it back is a problem, so there's extra pathways. And one of the extra pathways in the veins from the legs is the great saphenous vein. So it's a fairly long vein, because unlike the arteries, which have lots and lots of little names, the sort of extra veins are just all called one thing. So the great saphenous vein goes all the way from the foot and the lower leg all the way up here into the iliac, into the external iliac vein. So it's a beauty, and it's on our list. There's also the lesser saphenous vein, which isn't even on our list. So, and most of those other ones, you really can't see good examples of those until we get to the iliac veins. And then they look absolutely great, and they illustrate the idea that there are partner arteries and veins. So here are the external iliac arteries. These are the external iliac veins returning. Here were the internal iliac arteries, internal iliac veins returning, and now the blood supply is common going this way, so these are the common iliac veins here. So they're exactly matching the arteries of the same name.
So that would be internal iliac
This would be this would be the right internal iliac vein if we wanted to give it its full length. So if this was number 5 right here, then it would be the right internal iliac vein. And this would be the right internal iliac artery right next to it.
Left. Oh, right next to that one. Okay,
right.
not this one.
Yeah, that one there. Okay. Yeah, got to make sure we get right from left. So then we're moving into the pelvic region, which I did. Abdominal region, we've got the left and right renal veins for sure. There's a little curiosity, which we can't see on here, but it was on one of the pathways, which is the odd fact that the gonadal veins, whether it's ovarian or testicular, the right one goes straight into the inferior vena cava, and the left one, for some bizarre reason, goes into piggybacks into the left renal vein and then into the inferior vena cava. So when it was asking for the 2 pathways from the testes to the right hand, the left one's going to go via the left renal vein. Why that's true, I don't know, but it's true for men and women. And it's also true for cats. When we used to do the cat dissection, you could see it very clearly. Yeah, so somewhere in our distant ancestry, that kind of got locked in and never had a reason to change. So there it is. Moving along though to things we can see. So here's the inferior vena cava, and very large it is. And anybody see the Body Works? Anybody ever see Body Works? Do you see it?
Yeah.
I mean, I know veins are bigger than arteries, but I was surprised to see, I mean, the abdominal aorta is a pretty good size, and then the inferior vena cava is just this huge stretched out thing. It's like twice the diameter. So it was just like really huge. I thought, whoa, that is big. Because it's very hard to, you're working against gravity to get all of this up, relying on the respiratory pump to try to get it through the diaphragm. It's just going to pool a lot of blood, and so I guess it gets stretched out. But I was surprised how much bigger it was in that particular person's example. But anyway, so where's all the rest of the digestive viscera? Where's all the superior mesenteric and the inferior mesenteric here and everything? Well, they're all collecting, and they're not going to go into the inferior vena cava. They're all going to go to the liver. All the food we've just eaten and had the absorption from, we're going to go to the liver for some kind of purification to make sure that we didn't eat or drink anything too foolish or too large in quantities or whatever. So we're going to try to detox what we just ate before that blood's allowed back in the blood system and goes through the brain. So, and the spleen also, because the spleen is where the red blood cells get their comeuppance, and so all that iron is going to be brought. So all of these vessels from these viscera are going to go through the hepatic portal vein. So this is actually the superior mesenteric veins collecting here. This is actually the splenic vein coming from the spleen, since that must be the gastric vein because it's coming from where the stomach supposedly is. So all those things are collecting in and going to the liver via the hepatic portal vein, and you know that if I could see the hepatic portal vein anywhere in there, it would be a choice one for me to put on, but unfortunately I can't because we can sort of see everything heading towards it. The next thing we know, we're in the liver, so I really can't. But I can see this going out from the liver, all of that blood going back into the inferior vena cava. That is the hepatic vein, not the hepatic portal vein, which is bringing the blood supply to the liver, the used blood from all the digestive viscera and all the digestive food and stuff. But the hepatic vein then is what's going out of the liver. So if we just had a hepatic artery and a hepatic vein, artery becoming in, vein would be going out. So that's the hepatic vein. It just carries a lot more blood than its regular blood supply because it brought in from all those other organs. So if that does get marked, you've got to mark it as hepatic vein, not hepatic portal vein. Then we have the arms, and again, there would be an ulnar, a radial, a brachial, and all of those. They're just not shown. What is shown is the two extra ones, kind of like the great saphenous vein. So we've got, and again, they only have one name for their whole length because they're sort of extras, the basilic and the cephalic vein. And so, and they're listed on here. So the cephalic is this outside one, and here's the basilic vein. It shows a little bit of the brachial vein. It has the same number as the brachial artery, 24, so we can see they go together. So how can we remember which is which of these? Well, we can remember the two B's end up joining together. So the brachial and the basilic end up joining together, and then the cephalic comes in higher up here. So, and this little vein going across here, which would go across probably not at such an angle, but more like that, is the median cubital vein right here where blood is often drawn. So that's just put in there too. It doesn't show it very clearly and well, but it kind of is a, so if, you know, if this is moving sluggishly, we can scoot over there and, you know, switching lanes on the freeway or something.
Which one's right, this one?
I'm not sure even what that's meant to be. To be quite honest, I don't know. There's a lot of disorientation. Okay, so then, as we get up here, we're starting to get our partner system again. So here, a little bit of the brachial, not enough really to make that very fair. If I'm going to go for the brachial, I'll probably go for the brachial artery, because that's just a little stubby thing there. But it would be the brachial vein. This joining up, we're in the axillary region now, right in the armpit. So there's the axillary vein. As soon as the cephalic joins in, we're right next to the subclavian artery, and here's the subclavian vein. And on this side, we've got just that much of the subclavian vein showing there. So there's the subclavian vein. And this vein, now here's the one case, or one of the probably very few cases, where we have what we might consider a partner vein, but it doesn't have the same name. We have the carotid artery and the jugular vein. And why, I'm not sure, but they ended up with two different names, maybe because the neck is kind of important. So actually, when people say they're going for the jugular, although that probably isn't great, it's better than going for the carotid, because of all the pulse in the carotid, you'd lose a lot more blood than if somebody merely stabbed you in the jugular. Of course, neither would be particularly
Remember that
right.
later.
So I'll go for the jugular. Oh, well, I'll go for the carotid then.
Yeah.
What do you think about
I'm
that?
going to wait to use that someday. It's going to happen.
Yes, yes. The other one is when, which I always get on, I belong to a writers group, and people are sometimes saying, the blood pulsed through his veins. I'm like, oh, I don't think so. When it's comments time, you know, it comes around. Okay, blood pulsed through his veins? Pretty unlikely. Let's feel that. That's an artery. So, anyway,
So that one was the jugular, right?
so that's the jugular. It's actually the internal jugular, which is by far the bigger of the two jugulars. So this is the right internal jugular vein, kind of partnering with the common carotid, and here's the left internal jugular vein, kind of partnering with the left common carotid. Then they're going to, the subclavian vein and the internal jugular vein are going to join up to form the brachiocephalic vein. And there should be a it looks like there's one on this side, but not really here. But actually, there is meant to be a left and a right brachiocephalic vein, but only, if I'm going to put it, I would only put the left one because they haven't given us anything to work with. There's a model of, let's get this model and show.
Go, Dad, go.
This shows a little bit more symmetrically. There you go, my dear. Oh.
She looks like an Elizabeth to me.
There you go, Lizzie baby. So, but here you can see that, yes, this is a little bit shorter than that, but it definitely makes more of a Y. Here's the superior vena cava, and there's the right and left brachiocephalic veins.